Hello viewers, welcome to Excel Health Arena, and we are still on family planning. We are talking about intrauterine contraceptive devices. Intrauterine contraceptive devices are inserted into the uterus, into the womb, and when they stay in the womb, they have a way of preventing pregnancy. And I was talking about the mode of action, the way they work. I said when they are inserted into the uterus, they tend to cause a form of inflammation in the uterus. The uterus is inflamed. Inflammation that is in response to it as a foreign body. So when there is an inflammatory process in the womb or in the uterus, it attacks the white blood cells. It attacks the white blood cells, and we know the white blood cells are the kinds of cells that help the body to fight infections. So in a way, the white blood cells, when they see infections, they try to attack infections in the body. That's what they do. They are bodyguards that are in the body to prevent infections or protect the body against infections. So when there is inflammatory process in the uterus, the WBC, that's the white blood cell, is attacked by this inflammatory process. And so when this happens, these white blood cells now produce a form of antibody, which is a toxic substance to the sperm. And it attacks the sperm in response and destroys the sperm. That's the way it works for the first generation. Then the second generation, which is the copper containing intrauterine device, it releases copper in addition to the inflammatory process that it initiates because of its presence in the uterus. So the second generation devices also release copper. They are copper containing. So they release copper. Copper is also a substance that is toxic to the sperm. So it also destroys the sperm. That is for the second generation IUDs. Now for the third generation IUDs, these are hormone containing. So they contain hormones. And so these hormones, when released, they have a way, levonorgestrel, they have a way of increasing the thickness of the cervical mucus. Don't forget the way we said hormonal methods work in preventing pregnancy. So this time around, the hormones also thicken the mucus, the substance that is secreted from the cervix. So when it is thickened, it makes it difficult for sperm to pass through it. So you can see that a lot of things are, working together just to make sure that sperm does not have access to go and fertilize the egg. So a lot of things are working together, collaborating against the sperm, because they just don't want the sperm to have its way to the fallopian tubes to go and fertilize the egg. And in a way, they do not allow pregnancy to occur. So these are the three major devices. First generation, just the plastic device. Second generation, copper containing device, usually T-shaped. And the third generation, they are the hormone containing device or devices. So now, the advantages of intrauterine devices include simplicity. They are quite simple. They just come to the clinic, we insert, and they stay there between 3 and 10 years, depending on the type you use. So I am not prescribing any one for you here. When you get to the clinic, you would be attended to appropriately, and they can be able to determine which type would best suit you based on some other questions that they are going to ask you, because your history also matters when it comes to the most suitable method of family planning that you can think of uptaking as a woman. So Simplicity is an advantage. Then insertion does not take time. Few minutes, you are done. It is also easy to remove. Go there, few minutes, in fact shorter than the time it takes to insert. Yeah, because they just pull on it and bring it out. So it is as simple as that. It is not also expensive. It is cost effective. It is not expensive. So in a way, one of the benefits is that it is cheap, so affordable, and any woman can be able to go there and access it and afford that device. It is also it is also a continuous thing. It can be sustained. Okay, you use it for a particular period of time. Sustainability in the sense that even as a young woman, if you start using it, you can use it for a very long time. It doesn't matter. You can use it for decades, 10 years, 20 years, 30 years, until you are ready to remove, to stop it finally. You will be removing it depending on the type you use. There is the one for 5 years, there is the one for 10 years, there is the one that could be a little bit lesser than that, and sometimes for certain other factors, the one that is meant to take 5 years, you may have need to remove it earlier than 5 years. Mind you, because we said it can take 5 years, for example, does not mean if you get it inserted, it has to stay up to 5 years before you remove it. No. So if you take up the one with for that can last 5 years, if at the end of 2 years you just feel that you need to get pregnant at that point, you go ahead and remove it. And once you remove it, another advantage is that once you remove it, the next month just plan towards pregnancy, you can get pregnant. That is the advantage it has over the hormonal methods. Hormonal methods, except for the Mirena coil, the 3rd generation, which contains hormones. And hormones, of course, will still be in the bloodstream for some time. So it could take few months before it is reversed eventually and the woman is able to get pregnant. So, but for other ones, you can get pregnant the next month once you remove it, and that will be all. So it is quite temporary. It is very reversible, temporary. Now, it also has some contraindications. There are certain conditions or situations whereby you are not advised to take up intrauterine devices. One, if there is cervical cancer, it's not good enough. If there is pelvic inflammatory disease, if there is sexually transmitted infection or disease, you need to note that this will get complicated if you use intrauterine contraceptive devices. If there is sexually transmitted infection, if there is pelvic inflammatory disease, those two need to be well treated before you can think of taking intrauterine device as a method of family plan. Then, if there is abnormal vaginal bleeding, the vaginal bleeding cannot be explained, or it's just abnormal, they find it difficult to correct it, or they are not yet able to correct it, it is not advisable that you take up intrauterine devices. If there is abnormal uterine anatomy, if there is abnormal uterine anatomy that in a way that maybe the uterus is malpositioned, in a situation like that, because it has to do with positioning in the uterus, for that reason it is advisable that you don't take up such method. Then if there is history of previous ectopic pregnancy, if there had been history of ectopic pregnancy, it is better you avoid it, because it may also predispose to that, even though naturally ectopic pregnancy is not a general side effect for intrauterine devices. Then if there is suspected pregnancy, if the person is suspected to be pregnant already, don't use it. Then other side effects from intrauterine devices, there could be bleeding. I have said it earlier. There could be bleeding, there could be pain, there could be pelvic infection. That's why it is not advisable in people with pelvic inflammatory disease or sexually transmitted infections. There could be uterine perforation. Maybe in the process of inserting it, if you go to quacks or people that are not well trained in doing it, they can perforate the uterus. There could also be pregnancy at the end of the day, or there could be ectopic pregnancy. So all these are possibilities, possible side effects of intrauterine contraception.